wondering, so Fraser Health has really emerged as kind of the epicenter or a hotspot of the pandemic in BC. And I'm just wondering what other factors besides, there's more virus circulating in those communities could be fueling the increases there?
Well, the more virus circulating is certainly part of it, and I really want to emphasize, we have geographical boundaries that we use for administrative purposes, but this virus doesn't recognize those boundaries, and it really is across Metro Vancouver that we're seeing issues, and it's different in different areas of Metro Vancouver. But I will note that particularly in what we call the Fraser Health region, that is where a large proportion of essential workers live. So people who have been going to work, whether that's in healthcare, whether that's working in poultry processing or vegetable and fruit growing or trucking, we have a large proportion of people who are living in that region. And as you know, we report cases by area of residence. So people may be living in that region, but going back and forth to work in different areas of the province, going back and forth to the United States for certain trucking and essential services, etc. So that is a large part of why we're seeing concentrations, but we're also seeing that there are large parties, family gatherings even. They may be smaller than 50, but there are multiple ones where we've seen transmission to multiple generations. We also know that some of the accommodations for people like temporary farm workers and others are sites where we can see more increased spread very rapidly. Some of the businesses that we've seen. We also, of course, have all of a large number of our provincial correctional facilities and federal correctional facilities are all in that region. So it's a combination of we have a huge number of concentrated, risky environments and people who work and live in that area.
Do you have a follow-up, Brenna?
Sure. Just quickly, it doesn't sound like you're pondering regional restrictions like some other jurisdictions have done, but I'm just wondering about the concentration of public health resources in hotspots and whether there's more targeted messaging or measures that could be suggested.
Yeah, and we absolutely have been doing that. Our approach has always been to have the minimum provincial measures that affect those settings where we see transmission events happening. And as you know, things like we saw parties in resorts and vacation rentals, and so we put in limitations, recognizing that it wasn't just interior health. And as a public health service, we are supplementing and supporting each other where these hotspots spring up. So we've had interior health in the summer. We've had issues in the north where we've had to support the public health workforce there. And again, in the lower mainland or Metro Vancouver in particular now, yes, we're making sure that we have surge resources to support in those areas. Now, I think relatively unscathed has been Vancouver Island, although we do have occasional cases and clusters over here as well.